Heart valve repair versus replacement, how to decide for a particular patient. I'm Dr. Vishal Khullar. I'm a consultant in cardiac surgery at Fortis Hospital, Mulund. Heart valve repair means that a patient's native valve is preserved. The patient's own tissues are utilized for repair, whereas replacement means that the valve is replaced. It is excised, replaced, and replaced with an artificial heart valve. Now, there are two kinds of artificial heart valves, mechanical valves and the tissue valves. So when we talk about heart valve repair, we are basically talking about mitral valve repair. And the reason is that mitral valve repair or tricuspid valve repair. Then the reason is that the aortic valves are actually difficult to repair, because if the valve is narrowed down, usually there is a lot of chunk of calcium in the aortic valve, and those valves cannot be repaired. It is impossible to repair. But in the aortic position, when we are talking about the aortic valve, a valve repair is possible if it is a leaky aortic valve. Especially if the sinuses are dilated, then we can reduce the size of the sinuses and repair the aortic valve. Now, there are certain conditions like, the aortic root aneurysms, where the sinuses of the aortic valves are dilated, and it is possible to do a valve-sparing aortic root replacement. The patient's own native valve can be repaired and preserved. Hence, when we talk about valve repairs, it is for mitral valve pathology. Now, that pathology can be a mitral valve prolapse, like if the valve is myxomatous, it is doming into the left atrium, both the leaflets are doming into the left atrium, then it is possible to repair. Other pathologies where we can repair the mitral valve is degenerative mitral regurgitation. Because of the advancing age, the tissues, they get degenerated, so the valve leaflets are thinned out, they get stretched and they become leaky. In those cases, it is possible to repair the mitral valve. But if the valve is totally destroyed, or there is heavy calcification of the valve, or the valve is destroyed because of the infection, then it is better to replace the valve. Now, there are several advantages that we get if we are able to repair the valve, and one of the advantages is that patient's own native valve is preserved, so we don't need to put an artificial heart valve like a mechanical valve or a tissue valve. We know that for a mechanical valve, the patient will require blood thinners for the rest of his life, and a tissue valve will degenerate over a period of time. So these are the advantages of repairing the native.